Hi, I'm Dr. Palafox. You have cancer. These are 3 words that none of us ever wants to hear. But what if you had the opportunity to figure out if you were at higher than normal risk for certain types of cancers? Would you take the opportunity to find out? The answer lies in your family history. The medical community knows that there are several types of cancer that can be associated with a change in a patient's DNA that makes them higher than normal risk for those cancers. Not only that, but it can get passed down from generation to generation. These include breast cancer, ovarian cancer, pancreatic or prostate cancer, colon or uterine cancer, or the skin cancer melanoma. The National Cancer Care Network has established guidelines for your doctor to figure out if you might benefit from genetic testing to look for one of these DNA changes. If you're one of the patients that falls under these guidelines, then you can do a saliva or a blood test to look for one of 35 DNA changes that can make you at higher than usual risk for these types of cancers. The most famous recent example is Angelina Jolie. She has a BRCA or BRCA mutation. This gives her a pretty high risk for breast cancer. But did you know that she also has a pretty high risk of ovarian and pancreatic cancer? Not only that, but she can pass on this BRCA gene to her daughters and to her son. Knowing that you carry a mutation like Angelina Jolie gives you the power over the possibility of cancer. You can do additional testing, you can make lifestyle changes, you can take medication, or in some cases have surgery to either significantly lower or completely prevent cancer. You can control your destiny. So how do you know if you might benefit from genetic testing? Let's say you are of Ashkenazi Jewish heritage, or you have a male relative with breast cancer. You're a candidate for genetic testing. What if you or a close relative has ever been diagnosed with a rare cancer, pancreatic cancer, uterine cancer, ovarian, or stomach cancer? You are a candidate for genetic testing. What if you have been diagnosed with breast cancer before the age of 50, or you or a relative have been diagnosed with triple-negative breast cancer before the age of 60? You're a candidate for genetic testing. What about 2 or more relatives on the same side of the family with breast or colon cancer? You also might be a candidate for genetic testing. Not only that, but the American Society of Breast Surgeons recommends that any woman diagnosed with breast cancer, regardless of the age at which she was diagnosed, should have genetic testing. It's that important. Having a DNA mutation is not a death sentence. It's not a guarantee that you're going to get cancer. But knowing that you have a DNA mutation lets you get ahead of the higher risk. Remember, knowledge is power, and genetic testing can give you the opportunity to control your genetic destiny. To schedule a consultation, call my office.